All right, hello all, it is Dr. Alsip, and in this particular session, which is going to be relatively short compared to some of the other ones, we are talking about the ligaments of the wrist and the hand that you need to know for this particular session. And really the star of the show is going to be the transverse carpal ligament, aka the flexor retinaculum. Remember, we've discussed in previous sessions that you will hear them either way. So let's get our bearings in terms of where we are. This is going to be the first digit here. This will be the fifth. So which side is medial and which side is lateral? Fifth digit will be medial. First digit will be lateral. So with the first digit, we know that this will be the thenar compartment. This will be the hypothenar compartment. And then importantly, when you're trying to identify the transverse carpal ligament, you can see the tendons of the anterior compartment of the forearm, and then you can't because they dive deep to the transverse carpal ligament. Same thing for the median nerve right here. So you can see about where this transverse carpal ligament is located. It will also go deep to some of these structures as well, but you can see that that median nerve and those tendons are you can't see them anymore because they are going under or through the tunnel, so they're under the roof of the tunnel, which is the transverse carpal ligament. In other dissections, you may see left a palmar carpal ligament, which is going to be a bit more proximal. It's usually a little bit thinner, and it's not going to be any of those deeper ligaments associated with the radiocarpal joint because you're going to have to be nearer to the bone in those particular to identify those. So for me, when I'm trying to ID this, I always try to find that median nerve and those tendons. That'll really help me have an indication that if they are diving underneath a ligament, that is likely going to be your transverse carpal ligament, which is certainly the case here. And that, like I said, this is the main ligament that you need to know for this particular session. You can use this in conjunction with the review of some of the ligaments that we discussed with the joints of the wrist region. All right, thank you. Have a wonderful rest of your day.